So every day that passes feels like a gamble to me, a gamble that my insurance company is willing to take. And this is what this feels like. So back a year ago almost, well, not a year ago, but in November, I first went to the doctor about a feeling that I had in my stomach, a weird feeling that I have never had before. And I just didn't know what it was, you know, and it was uncomfortable. So I went to the doctor and they looked at it and they wasn't sure what it could be after talking to them. And I got Blue Cross Blue Shield. And they decided, all right, let's get you a colonoscopy, you do for that, but we'll also give you an ultrasound, which they did. And I did that on, I think it was November or December, I think it was December 21st when I got the ultrasound. But then the hospital that was supposed to do the look at the scans took a whole month to look at the scans. They said partially because of the holidays and everything. So I got those results back in January, say 20th or something like that, with a lot of pursuit from me going to the hospital and so forth to get this information. And this was at this St. Joe's Hospital in Lakeview. And so after the medical staff that I was with at that time looked at it, and they said, well, we don't see anything. And this was one of those over the phone type doctor appointments. And they looked at it, they said, we don't see anything, you know, we can't look under, we can't see under your pancreas, you know, so there's some more that we could do. But at this point, we're not in the position to go any further. But what we would like to do is have you see a GI specialist, and maybe the GI specialist could determine whether or not there's more for us to think about. So they scheduled an appointment with the GI specialist. I got that scheduled for February 19th. So on February 19th, I go see the GI specialist. She looks, she talks to me, and I should have mentioned, I mentioned maybe I had a hernia. And the doctor at the time, like, okay, that could be a possibility. But I brought that up. You know, no doctor had, said that. And so they looked, so then he asked me to look in the mirror, because as I told you, it was an online type of appointment. And so he looked, he said, do you see it bulging out? And I'm like, no. And he's like, well, there is a thing called a hiatal hernia, which kind of comes up towards your esophagus, and there's a chance it could be that. But, we don't know. Like I said, these are just guesses at this point. So I had to see the GI specialist on February 19th. On February 20th, I got a call back from the same office after they had set up an endoscopy. I know I'm messing that up, but basically what this is a colonoscopy, a reverse colonoscopy, where they go through the esophagus and they look at the stomach there through that way, and they can see a little bit more. And they also wanted to do a CT scan. And they scheduled both of those things. But on the February 20th, the day after I saw that GI specialist, she called and she's like, you're no longer in network, so those referrals aren't going to work for you. Blue Cross Blue Shield had changed my network, which I wasn't aware of. I did get a piece of mail saying that they had changed it, but it was kind of critical because they changed it obviously they did. They let me know, and that doesn't take away from the point that I'm about to make. So stick with me. But so what they told me was that you can't use the referrals that we gave you, which I would have been getting those. I would have gotten that CT scan back in March. I would have gotten the endoscopy, this reverse colonoscopy where they go through the esophagus. And I would have got that on February or April 23rd. But I couldn't. I had to get a new primary care physician at Northwestern, where I'm now and network. And that in order to see a primary care physician who could then give me a referral to a GI specialist, I can't see the soonest doctor I could see is August 13th. Now remember, I first reported this in November. So I'm like, what am I supposed to do? You know what I mean? I just gotta wait and just, you know, but my fear is, what if I got a cancerous something growing in my stomach? When my father had prostate cancer, he was upset because it was March, the last week, it was like 2 weeks into March, and the doctor told him he wanted to have the surgery on April 1st. And my dad was like, April 1st, that's April Fool's Day. I had to look at my dad like, man, they telling you they need to get this out of here, which is why I'm my own advocate now, and I want to know what's going on with my stomach, because I don't know if something is growing in there, but whenever I'm doing certain movements, I can feel it. And so I know something is happening, I just don't know what, and I want to get to the bottom of it. And now here it is. I'm not going to get to see a primary care physician until August. So I thought, all right, what could I do? You know, I don't know. I just got to live my life until then and hope that nothing's growing in there. But then I decided, you know, I had been feeling it a lot when I was doing different exercises and things. So I'm like, you know what? I'm feeling it more than they did the ultrasound for the upper right quadrant of my stomach. But I'm feeling it on the left a little bit. So I decided I'm gonna go to urgent care. So I went to urgent care, I guess 2 days ago, maybe it was April 21st or 22nd or something. And in urgent care, the lady said, well, there's nothing we can do for you here. We would need to give you surgery, which is that reverse colonoscopy. That's the name I'm calling it because I forgot the name, all right, don't trip. So they decided, okay, yeah, we're gonna do that. We're gonna give you a referral. And now I can see a referral more sooner than I would have been. I can see a GI specialist more sooner than I would have been able to had I had to wait to see this primary care physician. I call. They're like, all right, I'm gonna let you know we're a little backed up. They can't see me until December 13th. So at December 13th, it will be a full year of me dealing with this. And I just don't know. Why did they switch my network like they did? Did they switch my network in order to to hold this off? Because I was right in the middle of getting to the bottom of my issue, and now I got everything set back another year. Because if I go see the GI specialist on December 13th or whatever, I'm probably not gonna get the reverse colonoscopy until January. I'll be well into a year of dealing with this. Now, I just told you the doctor was worried when my dad's situation was only gonna be 2 weeks. He like, we gotta get this out. And I'm praying and hoping that I don't have cancer, but at this point, it feels like Blue Cross Blue Shield don't care, because they're not giving me any answers. I've called, had many, more than one conversation, telling them exactly what I got going on, and they know that I was in the middle of this process, and they don't even care. They're not even trying to help me get to see somebody. There's gotta be other GI specialists that I can see. I do have an HMO, maybe that's part of it, but I will be paying into this insurance for basically 12 months before I even start to get to the issue that I have going on. How is this okay? Let me know what you think in the comments, or if you're dealing with anything like this. This is a different video than I usually put on my channel, but part of me really feels like I am a fitness channel. I am about health. So I feel like I need to bring this up, because I know some of you guys may be dealing with some of the same situations when it comes to healthcare. And all over the world, we're hearing about these horror stories, and I have a platform with, you know, 10,000 of you guys on it. So I feel like I need to put this out here so that we could try to, you know, bond together and make these insurance companies do some things that should be done for us, because this ain't right. So yeah, that's what I got for you guys today. And man, I'm just gonna keep praying that everything is cool. And at this point, you know, I'm hoping I got a hernia, but, you know, I also don't want to do something where, you know, I should be having a simple surgery that's planned to deal with the simple hernia, or to deal with the hernia, opposed to a rupture when I'm in an emergency room somewhere trying to get something done, and it's a much bigger problem, which would obviously be more money for them and everything. So I just don't understand why they won't help me, but I want to put it out there. Hey, thanks for watching. Make sure you let me know if you got any comments or, you know, questions, or if you have similar stories. And if you have similar stories, definitely pass them along, and I will start to make a tapestry of these videos and post them so that we can make sure that it's getting out there to the people. All right, I appreciate y'all watching. Love and peace, everybody. Out.